We had a question come in on the live feature, so we've prioritized and said we're going to answer this question today.
Sounds good.
Somebody wrote in and said, what if it's a teenager teaching social skills? Is it quality ABA, or do you go around and do it by means of cognitive therapy?
Right. It's a great question, and I really am happy that your viewer asked it. So social skills training for folks on the spectrum, regardless of whether you're children or adults, adolescents, whatever it is, can be very effective using an ABA format. And actually, a lot of the more sort of high-functioning or higher-order social skills training that we do at CARD looks very similar to what she is probably referring to as cognitive or cognitive behavioral. And basically, what it is it's talking about what social strategies are going to be effective, helping the individual on the spectrum identify what they value. You know, well, what do you want to do? You want to make friends? Do you want to hold better conversations? Do you want to understand where people are coming from more? Setting goals. And then practicing, okay, which is behavior, right? Talking through it, thinking about it, which is the cognitive part, and making sure to practice in a lot of different ways across a lot of different settings and a lot of different people so that you get generalization. So you get the ability to actually apply that new social skill in general in your life rather than just memorizing some behavior in a particular situation. So yes, ABA, high-quality ABA can be used to teach social skills to adults, absolutely. And some of the cognitive behavioral programs can actually be quite effective. And honestly, what you'll see is there's a lot of overlap between them.
Okay, but what's going to be key is that in this moment in time, your insurance is going to more than likely cover the quality ABA.
That's correct.
And not the cognitive skills.
Well, that's correct. And some insurance companies will or will not cover social skills training for adults on the spectrum because they might argue that it's not medically necessary. So it might fall to you to make an argument that social skills for an adult is medically necessary. And it depends on how you define medically necessary, and it depends on how you define social skills. The ability to communicate with others, is that medically necessary? Yes, obviously, right?
Yeah.
But something really subtle like understanding the difference between someone else's preferences versus their desires or something, is that medically necessary? Probably not, right? So there's definitely a lot of gray area in there. And it probably depends on how closely you can tie the targets that you want your son to work on with skills and consequences and outcomes that have clear, obvious medical impacts on their life.
So that's the case you would present, but of course there'll be lots of things taught once you get there and are getting the training.